My name is Ronald. I'm going to be your dental hygienist today. This is Fei Fei. She is adult patient. So at this point, we finished the cleaning. There were a few pieces of calculus. I removed those for you. You're good to go. And do you have any questions for me?
Yes. You mentioned biofilm. What is biofilm?
Good question. Biofilm, when we eat food and we don't brush well, some of the food stays behind, and bacteria love to go and live where the carbohydrates are. That bacteria starts to multiply, it starts to accumulate, it turns into what's called a biofilm. Biofilm, if it's not removed via brushing, flossing, starts to harden and becomes dental calculus. This is a problem because one, you can't remove calculus. You have to come to us to remove calculus for you because it's too hard. Two, biofilm and calculus, they will cause gingival inflammation that can lead to gingivitis, periodontitis. We don't want that. So I do want to ask you, I want to see how you're brushing at home, what your oral health care routine is. So please, here's a tooth model. Go ahead and show me how you brush at home.
Brush like this.
Okay. So that's good for getting residue, food, or biofilm off the tooth surface, but I do want to show you a method where you can get a lot more biofilm out. So you take your brush, you position at a 45-degree angle to your teeth, to actually the gum line right here. You brush 10 times in a segment of 2 to 3 teeth. After that, swipe it down. Next teeth, brush them at a 45-degree angle, swipe it down, and you'll do that for all the teeth. Now when we go to the front teeth, it's a little bit different. You want to brush them like this so that you're getting the gum line and the tooth surface, and you would do the same thing for this. So if you don't mind, I just want to see if you can show me how you're going to brush from now on. And
Yes. 45-degree to the sulcus and 10 times horizontal brush and sweep.
good.
All right.
Mm-hmm.
And then for the inside, horizontal like this.
That's pretty good.
Can I use my left hand?
If you can use your left hand. All right. So it looks like you understand this method. I do recommend that you brush 2 times a day for 2 minutes, just so we can get the maximum amount of biofilm residue out, so we can minimize all the negative effects that bacteria can cause to our teeth. Aside from that, I think we're good to go. Thank you for coming.